So that collaborative is a really important word in patient treatment. And I think, again, surgeons 20 years ago, it was like the surgeon, and everything else was kind of considered ancillary to the surgeon. But we really understand much better how important the team is to taking care of patients, and that the patient is at the center of the team, and we're just all there to try to make the outcomes be as good as they can. So working with a brace maker or an orthotist who's really involved and really tries hard to understand the problem, it can be super helpful. And so for me, it's been great to work with Luke. I worked with Luke for a long time, to work with someone who really understands scoliosis, who's committed to having the best outcomes. I believe in non-operative care as a really integral part of what we do when we care for patients. Even though we're surgeons, part of being a pediatric orthopedic surgeon is a huge part is non-operative care. And for scoliosis, that means bracing and casting. And I have really become a believer in the Know brace as, for me, in my hands, that is the best, most effective brace. Patients tolerate it well. We get really effective correction in the brace, which is usually a good sign that it's going to have a good chance of working. I feel like our results have been quite good compared to what's been written about for results with bracing. So working with a place that's really committed to scoliosis has been really important to my practice. Our clinic happens to be actually upstairs in the same building as one of the offices for
National Scoliosis Center.
So we've worked out an agreement where we're accessing their X-ray imaging system, which is an EOS imaging system. That's really important for kids with scoliosis because the radiation dose for an EOS image is somewhere between a 1/7 of a normal X-ray dose for a regular scoliosis X-ray to a 50th for the follow-up kids. So the follow-up kids get a microdose, which is even smaller. That's not so important if you only get 2 scoliosis X-rays in your life, probably. But if you get 20 or 30, especially a child that gets scoliosis diagnosed when they're 2 or 3 years old, that's a lot of X-rays. So being able to use the lowest X-ray dose possible is really important for those children. And so that EOS imaging makes that possible for us. So that's a really important new thing that we're able to offer